deal with elbow arthritis, there are really three primary causes that we think of in terms of creating this monster of arthritis of the elbow. And these start as early as 5 to 6 months of age, believe it or not. And I'll give you a very specific case that I operated recently. Um, I know one of the human orthopedic surgeons in town, and he told me that he got a new golden retriever puppy. And I said, "Oh, well, we should make sure that we don't have any things going on like elbow dysplasia or hip dysplasia." He says, "Well, he seems to be fine." Well, a couple of months later, he rang me up and said, "I think my dog is a little bit lame." So he brought the dog in, and sure enough, I squeezed on both elbows around the coronoid regions, and there was a painful reaction. So I said, I think your dog may have fragmented medial coronoid processes. And we did a CT exam. One of the things that tipped me off was there was reduced elbow flexion on one side. Normally, you should be able to flex the elbows to about, 30 or 35 degrees. Trying to get my body around here, right? Until the muscles actually limit for flexion. And if you're limited to something like this, I can guarantee you that there's end stage arthritis in that elbow, and the osteophytes of the head of the radius and the ulna that we'll see in just a minute on a CT
Mhm.
kind of just bind against the humerus, and you can't physically get any more flexion. So when we have loss of elbow flexion, we know we have end stage arthritis. We did a study where we compared normal dogs to dogs with reduced elbow flexion, and 100% of the dogs with reduced elbow flexion had moderate to severe radiographic arthritis, and they had reduced weight bearing as measured on a force plate. Even if we couldn't see the lameness, it was generally about 20 to 30% difference in weight bearing between the two sides. Because dogs are so good at hiding their forelimb lamenesses, it has to be pretty severe before we can see it. So we really need to use all of our tools about us, the history, the physical exam, careful gait evaluation, to really tell whether an animal may have a problem. So back to the issue with elbow arthritis. So we did a CT of both elbows. The dog had pretty severe arthritis in one elbow, had fragmented coronoid processes, which is a little chip off the weight-bearing surface of the ulna. And I told
Okay.
him I thought, based on the severity, that the dog would have end stage arthritis and probably bone on bone. In being a human orthopedic surgeon, he sort of, said, well, he's too young. He's only 8 months of age. How can he have end stage arthritis? So I took some pictures during the intraoperative arthroscopy and showed them to him. And there's definitely bone on bone. And what we see, at least on my screen, it's the lower left, we see